Okay, all right.
Okay, you're dispatched to an MVC. On arrival, you find the subject lying supine in the roadway, apparently ejected through the windshield of the vehicle.
Okay. Is my scene safe?
Yes.
I'm wearing my body substance isolation. Is this my only patient?
Yes.
All right. My mechanism of injury appears to be he was thrown from a vehicle during a motor vehicle collision, landed in the roadway. I'm going to go ahead and request for ALS because he looks, before I even touch him, he does not look to be in good shape. So my general impression is also poor. I'm going to go ahead and come in and take C-spine. While I've got C-spine, before I turn it over, since I'm already here, I'm going to assess his level of consciousness, yell at him, "Sir, can you hear me? You okay? Can you talk to me?"
He's
Any
not
response?
responding.
No response at all. I'm going to go ahead and do a modified jaw thrust to check his airway.
You notice gurgling and blood in the mouth.
All right. At this time, I'm going to go ahead and turn C-spine over to another EMT. Do they have it?
Yes.
All right. I'm going to come around and take care of the airway by suctioning. Does that take care of
Yes.
the airway problem? All right. Since he's unconscious and he's not responding to pain, I'm going to go ahead and try to put in an oropharyngeal airway. Does he take that?
Yes, he
Okay.
does.
All right.
He does respond to, he moans, some painful.
Moans a little bit. Okay. All right. Is my patient breathing?
Yes, he
right.
has adequate but somewhat shallow respirations.
Okay. Appears adequate, so I'm going to go ahead and put him on 15 liters oxygen non-rebreather, and I'm going to go ahead and assess his chest to look for any injuries that could compromise his breathing. Do I see anything out of the ordinary? Checking for equal chest rise and fall.
You do note paradoxal motion on the right side.
Okay, so appears we have a flail chest on the right side. Going to initially stabilize that with my gloved hand, but I'm going to call for another EMT to put a bulky dress in and tape it down and
Okay.
stabilize that flail section. Does that take care of that?
Yes.
All right. Pretty much taking care of breathing in this case. I'm going to move on to circulation. Does my patient have a carotid pulse?
He has a thready radial pulse.
Okay, so thready radial pulse. How's his skin color and temperature?
Cool, moist.
All right, so sounds like he's going into shock. I'm also going to do a blood sweep my hands, gloved hands down his body, checking for any major bleeds. I do see some blood soaking through his pants here.
Yes. Yes, that is a
gonna
major bleed.
Expose that, and it is a major bleed.
Yes.
Okay. Initially direct pressure. I'm going to call for another EMT to do direct pressure and follow that up with a pressure dressing. Does that handle
Yes,
it?
that's
Okay.
perfect.
So they're taking care of that. At this point, I pretty much already know I've got enough information that this is a priority load and go patient, unstable patient. So I'm going to call for rapid transport. While they're going to get the backboard and equipment, since we're going to put a C-collar on, I'm going to check his neck real quick for tracheal deviation and JVD in the front. I don't see any.
No,
Okay.
nothing noted.
No step off in the back either. So we're going to go ahead and apply the C-collar. Since we've got the backboard here, we only want to roll him once. So I do need to check his back real quick. So we'll bring the backboard in. While I've got him up, I'm going to check his back side for any injuries, especially his thorax, looking for any injuries that could compromise his breathing. I don't see any.
No, nothing
Okay,
else
so
noted.
we're good there. So back onto the backboard at this time. Real quick before we leave the scene, since he is unconscious, I'd like to get a sample history. I know I can't get it from him. Do I see any medical alert bracelets or jewelry?
Nothing noted.
All right,
And
any
doesn't have anybody
bystanders?
with him.
Nobody with him. All right, if they were, I would want to get a sample history, which I've already got his signs and symptoms. I'd also want to know allergies, medications, past medical history, last oral intake, and events, which we know Piercy was thrown out of the vehicle. So we're going to load, get in the back of the ambulance, and that's where I'm going to get my first set of vital signs.
Okay.
So I'll take a pulse rate.
Pulse rate's 120.
Okay. Blood pressure real quick. All right, for my patient, I got 120 over 80, what is it for the scenario?
90 over 50.
Okay, so once again, we'll prove that he's going into shock, so we definitely want to treat for shock, which we've already got him on O2, we've already got him on supine, so the only other thing we can do is cover him up, which we'll do, and conserve body heat. So treating for shock, I also want to get respiratory rate.
His rate is 22.
Okay, so we'll stay with the non-rebreather for now. So at this point, we're in the back of the ambulance. I want to go through and do my secondary assessment on the way to the hospital. Let me check lung sounds real quick. I'm going to take a listen to upper both sides and lower both sides. On my patient, my live patient, I've got equal bilaterally.
Oh, you notice diminished on the lower right side due to the flow segment.
Okay, all right, but I do still have some
Yes.
lung sounds still
Yes.
present. Okay, all right. Start my secondary assessment. I'm going to go through, check his scalp. Once again, looking for depressions, bleeding, contusions. While I'm here, I'm going to check his pupils. I'm getting equal and reactive to light.
Yes,
Okay. Do I have any fluid or blood coming out of the ears or nose?
none noted.
Okay. All right. I've already checked the neck, but we did that before we put on the C-collar. Is he still okay with the oral airway?
Get a
And
little more blood in the airway.
a little more blood? Okay. We'll suction again just to double make sure that's cleared out. After that, I'm going to check his shoulders. Come around. Once again, I'm going to recheck his chest, make sure that my bulky dressing over the flail segment's still holding together. Make sure I've got, decent chest expansion. Moving down to my abdomen, I'm going to check all 4 quadrants of the abdomen, checking for rigidity, tenderness, guarding, any of that noted.
Soft and apparently not tender.
Okay. Check his pelvis, push in, push out, checking for
Stable.
stability. It is stable. Do I see a priapism or anything that would suggest that?
Nope, not.
Okay. I'm going to go down each leg, checking for stability. Is the bleeding still controlled on my right thigh? Okay. Both legs stable.
Yes.
All right. I know he's unconscious, but I'm going to check a pulse. Sir, can you feel this? Any response?
No response.
Can you push down or pull up? All right. Same thing on this leg. I'm going to check for a pulse. Sir, can you feel this? Can you push down or pull up? Nothing. All right. Come back up to the arms. Check this arm for stability. Do I still have a radial pulse? Okay. Can you feel this? Can you squeeze my finger? Nothing. Same thing on this arm. Check for stability. Still a weak radial pulse on this side as well. All right. Can you squeeze my fingers? Can you feel this? No response. Okay. All right. At this point, we want to do a reassessment. Make sure we take at least a second set of vital signs. How is his pulse rate now?
It's still in the 120s.
Okay. How about blood pressure?
It's 100 power.
Okay, so a little better. Hopefully the supine position's helping with that. Respiratory rate?
20.
Okay. And still only responsive to some painful
And
stimuli?
O2 says 90.
Okay. All right, so we're going to continue with the O2, continue with the stabilization of the flail chest, call the hospital, let them know we're coming in. ALS never made it on scene, so we just had to pick up and run with what we had. And I am finished.